Tuberculosis, often called TB, is one of humanity's oldest and most persistent infectious diseases, remaining a major global health challenge today. While it primarily affects the lungs, this resilient bacterium can also attack other parts of the body, including the kidney, spine, and brain. The culprit is a slow-growing bacterium named Mycobacterium tuberculosis. It's an airborne disease, spreading when a person with active TB disease in their lungs coughs, sneezes, or speaks, releasing tiny infectious droplets into the air. Transmission typically requires close and prolonged contact in poorly ventilated spaces. It's not as easily spread as the common cold. Upon exposure, one of two things can happen, leading to the main types of TB. The first is latent TB infection. Here, the body's immune system is strong enough to wall off the bacteria, containing them within small capsules called granulomas. A person with latent TB has no symptoms and cannot infect others. It's estimated that a quarter of the world's population lives with latent TB. The second type is active TB disease. This occurs when the immune system can't contain the bacteria, either upon initial infection or years later if immunity weakens. The bacteria multiply, causing illness, and the person becomes infectious. Factors like HIV, diabetes, malnutrition, and smoking significantly increase the risk of latent TB becoming active. Let's look closer at what happens inside the body. When TB bacteria reach the lungs' air sacs, immune cells called macrophages engulf them. However, the bacteria can survive and multiply inside these cells. The immune system then mounts a larger response, sending other cells, like T lymphocytes, to surround the infected macrophages, forming the granuloma. In active disease, the center of this granuloma can break down into a cheese-like substance, and if the granuloma ruptures, bacteria can spread into the airways to be coughed out, or travel through the bloodstream to infect other organs. The symptoms of active pulmonary TB develop gradually. Systemic signs include fever, chills, night sweats, fatigue, loss of appetite, and unintentional weight loss. Lung-specific symptoms are a persistent cough lasting more than 3 weeks, chest pain, and sometimes coughing up blood or mucus. Diagnosing TB is a multi-step process. Screening for latent infection is done with a tuberculin skin test or a blood test called an IGRA. To diagnose active disease, doctors use a chest X-ray to look for characteristic changes in the lungs. The definitive diagnosis comes from examining sputum samples under a microscope and, most importantly, growing the bacteria in a lab culture or using rapid molecular tests that can also detect drug resi. Stance. Fortunately, TB is curable. The standard treatment for drug-susceptible active TB is a strict 6-month course of 4 different antibiotics. It is absolutely critical to complete the entire treatment, even if you start feeling better, to prevent the disease from relapsing and to stop the development of dangerous drug-resistant strains like MDR-TB and XDR-TB, which require much longer and more toxic treatments. Prevention strategies include the BCG vaccine for children in high-burden countries, treating latent TB infections, and practicing good infection control, such as covering your mouth when you cough and ensuring good ventilation. Through awareness, diagnosis, and treatment, we can fight this ancient disease.